Hannah Orfila of PSN 1B from Tomas Lord Colleges, and for this video, I will be showing you how to obtain the vital signs. Vital signs are very important because it gives us information about the physiological status of our patient. It also helps us detect and monitor the health problems and also visualize the current state of our patient. So vital signs includes the body temperature, the blood pressure, the heart rate or the pulse rate, and the respiratory rate.
So prior to conducting the procedure, we have first to perform a hand hygiene to remove all the transient microorganisms that are present in our hands and also to prevent cross-contamination. Then after that, I will be assembling all the materials that I will be using, such as the digital thermometer, the stethoscope, the BP apparatus or the sphygmomanometer, the pulse oximeter, the cotton balls and alcohol for sanitizing all the materials, and then of course a wristwatch with a second hand.
Hello ma'am, good morning. I am Hannah Orfila and I will be your student nurse for today. So ma'am, may I know your name and your birthday?
Senya Austria, February 23, 1969.
Okay ma'am, what do you prefer me to call?
Rose.
Okay ma'am Rose, I'm just going to inform you about the procedure that we will be doing for today. So ma'am, I will be taking your vital signs. In this, I will need to touch you in order to get your body temperature, your blood pressure, your pulse rate, and your respiratory. Would that be okay with you? So before we proceed to that, Mami, I know if you're feeling any pain right now, can you rate it for me from 0 to 10, wherein 0 means you feel no pain at all, and 10 is the worst.
0.
Okay, that is good, ma'am. Since I already know that you're not in pain, I am now going to take your body temperature using a digital thermometer. So, in checking the temperature, you can check it temporally, tympanically, orally, axillary, or rectally. But in my case, I will be checking the patient's axillary temperature. So, I'm just going to put the digital thermometer on her outfit. While waiting for the thermometer, I am now going to set up the BP apparatus on her right arm. So we're going to feel for the brachial pulse that can be found on the antecubital fossa area. Okay, I already felt it. And then I'm going to wrap the cuff around her arm. To make sure that the cuff is snuggly, I'm going to insert my two fingers underneath the cuff to make sure that it is not too tight or too loose. Okay, so I already heard the thermometer. The readings is 36.8 degrees Celsius. I'm going to sanitize the thermometer using a cotton ball and an alcohol. We're going to clean the tip. And then store it on its container. So going back to the blood pressure of the patient, I'm going to place the diaphragm of my stethoscope on the brachial pulse. So you can see here the arrow is pointing on where I felt the pulse. So ma'am, may I know what your last blood pressure, if you still recall?
140/80.
Okay, and then we're going to inflate the sphygmomanometer to 180 to 200 millimeter per mercury. And we'll slowly release it and listen to the Korotov sound. Okay, so the patient's blood pressure is 140/90. checking the blood pressure of the patient, I am now going to take the pulse rate. So if you have a pulse oximeter, you can use it. And just insert it on the finger of your patient. So as you can see here, the oxygen saturation is 99 and the pulse rate is 93. So if you don't have an available pulse oximeter, you can check the pulse manually by putting your index finger and your middle finger on the radial pulse of the patient. So we're going to check the strength of the pulse, if it's non-palpable, if it's weak, or if it's pounding or just normal. We're going to count it for 1 minute, but you can also count it for 30 seconds. Just multiply it by 2 if the pulse is normal, but if it's not normal, if the rhythm is irregular, if it's non-palpable, you can try listening to the apical pulse that can be found on the fourth intercostal space along the midclavicular line on her chest, and listen for 1 full minute.
And here I'm already counting the respiratory rate of the patient as I've moved the patient's hand near her abdomen and my other hand on her shoulder. We should not let our patient know that we are counting their respiratory rate because it may alter their breathing, so we just have to act as if we are still counting their pulse.
Okay, ma'am. So I am done checking your pulse rate and your respiratory rate. So your pulse rate is 90 and your respiratory rate is 17. So your pulse rate is 93. The normal range of your pulse is ranging from 60 to 100 for adult, and that's normal. That's the normal range. And for respiratory rate, your respiratory rate is 17. The normal range is from 12 to 20. Okay, ma'am. So thank you for your cooperation. What happened today and the result will be confidential and will be just between the two of us. And if it's necessary, I will let your doctor know about